afternoon, everyone. Welcome to Bonita's Maternity Program webinar. Today we got Sister Ingrid Groenewald speaking to us about pain relief and coping strategies. Hi, Sister Ingrid. I'm just going to unmute you and you can take it away.
Fantastic. I am so happy and pleased to be with you, and welcome to all the expectant moms and dads out there listening today, to this really exciting topic. I think all the topics are exciting, but specifically this one is the one that causes most people the most, I wouldn't say stress, but it's something that you wonder about and you really worry. How will you actually deal with labor? Okay, so it is an important topic also to understand how this actually works. Now, first of all, if you are in labor, I think a lot of times people have this perception that if you don't take any pain medication, that there's something wrong with you or you're very strong, and in actual fact, it's wrong to think that nothing happens because we all have endorphins. Now, you might have heard of endorphins, in your body. It's a hormone. It's a feel-good hormone. It's a hormone that's released when you are exercising, when you are running. This is the second breath that we often hear that people talk about, when you're one of the people, if you drive and you see people running next to the road, or any kind of long distance or any kind of exercise that you do, it's that sudden hormone release. It actually keeps you going. It actually gives you that second breath. So that is something that we all have in our bodies. But the day that you're pregnant, suddenly these endorphin levels, they start rising. So without you knowing what actually happens, it is in your body. It actually helps you in the pregnancy even to be comfortable, if everything that's happening. But then also in labor, these endorphin levels are through the roof, so if one would test it, it is very high levels that you actually have in your body. So it's not to say that if you don't take any pain medication that there's nothing working for you. You are in actual fact making your own coping mechanism, your own kind of medicine that actually helps you to be in labor. So that's the first thing. Okay, now we have to think, what can we do to help these endorphins, or what can you do to actually increase the endorphin levels? So just to take a step back to say, there are two different routes here. One can do the natural route, so that is any kind of non-medication, and the other option obviously is medication, which we will go over that as well. So if we go through the non-medical things, what can you do in labor that will help you cope, that will help you to actually be able to deal with the contractions and to eventually sit with your baby in your arms? Okay, so what is that you can actually have? So anything that helps the endorphin levels. Now, first of all, it's the companionship or the love. The feeling of being loved, the person who's there with you is very important. Now, for the dads listening here today, remember, even just your pure presence of being there helps a lot. Okay, so there are other things that you can also do, but your presence there is a huge plus. Okay. So the companionship, the being there, and this is also where doulas come in handy. So if you've never heard of the term doula, it is where you have a support person, an extra person there who's there for your emotional needs, for physical needs, like any kind of suggestions of what to do, and just by really supporting you. And that has been shown to really help reduce the need for pain medication, and also people have a shorter labor. So it is something that is quite useful, having an extra doula or a support person there. And it's not to take the person that is with you, not the birth partner. It's not taking the role. That person also supports your husband or your partner in labor as well. So that is the companionship, the first thing that I would say is really important. Then the next thing that you can also do is movement. So movement by swaying, movement. This is where my ball comes in quite handy. I put it there, but I just remember to also talk about it. So I call it the labor ball or the birth ball. It is a very useful tool. It's in actual fact an exercise ball that can be used for many different things, but also in labor, you can sit on it, you can sway. The swaying of the hips is a really good pain relief skill, and then also it helps to bring the baby down. So you can lean over it. So any kind of movement, walking, swaying, you know, all the kind of things that you can do with movement is a really good thing as well. And again, it releases endorphins, and you feel you're doing something, you have your partner there with you, and it actually helps to release the endorphins as well. The next thing that I would mention here is massage. So by having a massage is really good. And again, for the partners here listening today, it's actually been proven with some research that if you have a massage on a regular basis in pregnancy, even the possibility for prem birth is a lot lower. So perhaps this is now seen as your homework. So you can actually start to you know, massage the back, the legs, the feet, and so on a regular basis. It also helps to prepare you as to how to massage what is comfortable for your partner. Okay, so what can you use for massages? And this is usually in labor also very much the lower back on the sacrum area is quite comfortable to have a massage there. So you can use any kind of different oils. You get actually labor oils that you can get. Otherwise, if you know somebody who can mix an oil for you that is safe in pregnancy and safe for labor, you can use that. Otherwise, any kind of natural oil, anything, any kind of cream or lotion, anything that just makes it easy for your hands to move over the skin is something that's really beneficial. The pressing on your lower back, so you take this part and by pressing on the lower back also is a great relief for pain. So that is something that can be done. Again, it helps, that pressure helps, and it helps to also release the endorphins. Okay, so massage is a good one. You can use different things for massages as well. You have little balls. This one has little tentacles, or whatever you call it, little things on the sides, and you can use this to massage, you know, that the back, for example, or you can even put it on the floor, and by rolling your feet over these kind of balls also is quite useful. It helps to have different things to massage with, especially for the birth partner, so that your thumbs don't later on feel that they're actually going to fall off your hands, you know. So it helps to really have a good different variety of things. You can have these balls, you can use tennis balls, you can use these little wooden, I don't know what you call it, massages. You get it at a lot of flea markets. You can get them, and it helps to just use different. You can do different things, you know, for massaging on the lower back and the back specifically. So so that is actually quite useful to also use. So massaging is a very useful thing. The next thing here that I would say is also useful for coping in labor, and that is water. You know, so you don't have to think that, well, if I'm not having a water birth, can I actually use water? Yes, you can use water. At home, if you're still at home, you can go and bath, you can go and shower, and that water running over the tummy by being in a bath helps tremendously for pain relief, and it also helps for relaxation. Now, once you're in hospital, the same thing goes there. You can go and bath and shower at any point, okay? So don't worry about perhaps I'm not allowed to or something like that. You are allowed. You know, the thing is that water does really relax you. Anything that relaxes you is crucial. Okay, and just to explain here is that you've got different hormones. You've got adrenaline, that is a hormone that is the fight or flight hormone or the stress hormone. If you're very tensed and stressed, you've got a lot of adrenaline in your body. If you relax and you breathe and you're just really relaxing nicely, you have a lot of oxytocin in your body, and that is the hormone that keeps the labor going. Now, unfortunately, these two hormones can't work side by side. It's either the one or the other. So what in actual fact, what happens if you're stressing a lot, it actually means that it's pushing away the oxytocin, and you've got lots of adrenaline in your body, and that slows down labor. By trying to have a faster labor, it would be by doing anything that relaxes you so that you can actually have a lot of oxytocin in your body and very little adrenaline. Okay, so, and these are the things, the companionship, the movement, the massages, by being in the water. All these things, it actually relaxes you. So what it actually does, it helps you to have good hormones working in your body. The next thing is the light. Okay, so a lot of babies are born at night, or you labor a very big part at night. And here I would say switch off the lights. Okay, don't have it light in the room. You know, make it as dark as possible, because this is also something that we see a lot. If with darkness, it's almost more intimate, it changes the dynamics, the atmosphere in the room, and it's almost like your hormones can do better when it's darker. So even in hospital, if you're in hospital already at that point and you're in labor, and you know, there will be lots of times where you be left alone. So nobody's actually there with you, just the two of you who will be there in the hospital room. Switch off the light, you know, so that you can actually have it darker in the room. Your hormones are working better. The next thing that I want to mention here, it's called a TENS machine. Now, TENS machine is also a non-invasive. It's not medicine. Now, some midwives in the country actually have these TENS machines, and so it is something that can be hired. So it might be something that you can explore, the option in your area. So just to show you what this actually is, it's a small little device that comes with little cords, and it's connected to little what would you call it? It's like little plasters that you basically put on the lower back. So on the sacrum, on the lower back, you put these things. Then if you switch it on, what it does, it sends out electrical impulses, but it's very slight, and the mom can then also adjust the level. So you can adjust the level what is comfortable to you. It really interferes with the brain. This is really what it does, because our brains, when you're having contractions, there's this constant movement, you know, the nerves that are telling the brains that the uterus is contracting, and the brain that experiencing the pain of that, you know, so it's lots and lots of movement that goes on. If you add something, this is now where this TENS machine suddenly comes in. Suddenly, there's something else that the brain has to focus on. There are other impulses going to the brain from a different place, and that interferes a bit, okay? And that is why it really works well to try to reduce the feeling of pain. So moms actually do quite well with this as well, okay? So this is the TENS machine. The next thing of a non-invasive thing would be music. So the more music you play, any kind of music that's relaxing to you. Now just picture this, it's dark, you have music playing, something relaxing, something that you enjoy, something that you've been playing throughout your pregnancy. You've got movement going, you've got the smell of the, you know, of the massage oil that your back is being massaged. And this is also where I would add now, you can use aromatherapy oils. Now, this is also just important to make sure that you've got a correct one. You've got something that is safe in pregnancy and in labor. And the one that I want to point out here is lavender. And you can have, like, you get these little things that you put water, or you put salt at the top, and you put a little candle in here, and 1 or 2 drops of the lavender you put on there, and it actually releases the smell of the lavender, and that also relaxes you. So again, anything that relaxes you, that makes you calm, it in actual fact helps you that the endorphins really can work in your body, and this is what we want in labor. This is what's going to make the contractions stronger, and the stronger they are, the quicker you will have your baby. It does not help to have contractions that are almost not even felt, and it's a lot, you know, far apart. You want them very strong, because those are the ones that will actually help you to have your baby. Okay, so these are the kind of non-invasive, or the kind of things that you can use without, you know, using medication. Okay, so all these things, and remember, even change of scenery helps a lot. So if you've been in your little room the whole time, sometimes it feels like the room becomes really small. It is important to get out of the room, walk in the passage perhaps. So when you're not in hospital at that point yet, I would say walk outside. If you're, for the moms who are not having their babies in a hospital, use the garden, use you know, the street, walk outside, obviously in the daytime, not at nighttime, but it is something that's really beneficial. To just change of scenery really works well. Now if we move over to the medicine or the medical things. What can you use in hospital if you really feel that you need something? Okay. Now, the one thing that is the most common thing that is used in labor, I would say, is called pethidine. Now, this is the injection that's given. I just want to show you. It's just a little syringe, this one. Okay, so it just shows you the idea, really. This is medicine that somebody pulls up, so you have no control as to how much medicine is given to you. It's basically just given to you. It's an injection in the bum. Okay, so usually it's an intramuscular injection that's given to you. And what it does, it is a very strong medication. It's a Schedule 7 medicine. So for those of you who have had any kind of big operations, you might think back and remember that you got some medicine, and shortly after getting that, you actually felt really lightheaded and even like having double vision or triple vision even, but you fall asleep on this. Okay, so that is often something that can be given to moms. So it's just that it does not take the pain away. Okay, so don't expect having the injection and immediately you're not going to feel anything. Okay, you will still have contractions. A lot of moms have actually said afterwards, if they'd known how they're going to feel with this, they wouldn't have asked for this in the first place. What it does, for some, it might be a good idea for some moms, if it's early labor and you're experiencing really strong contractions and you're feeling of not coping, because it probably is going to make you sleep, and then when you're sleeping, you're relaxing all the muscles. Okay, so everything relaxes. What also happens sometimes is that if you are later in labor, it obviously, we know it affects the baby. So this is something that is not given later in labor, because we might just have a baby who's also really out of it, like really also feeling a little bit different. You know, they're not as alert with pethidine. So this is something often given, but remember, it's your choice. You can always say, no, I don't want it. So at any point, if somebody comes into the room and I want to give you any medication, always remember to ask, what is that? Okay, it's your choice, really. You can decide, yes, I want it, or no, I don't want it. Okay. The next thing that I want to point out here is Etinox. Now, Etinox is a mixture of nitrous oxygen, or oxide and oxygen. So it's a mixture of gas given. It's also called laughing gas. A lot of people call it laughing gas. It's not going to give you the giggles. Okay, so I don't know really why that name, where it comes from, but I just brought along a little oxygen mask. It doesn't look like these. These are the plain ones. The other one, the Etinox mask looks a little bit different, but it's the same idea. You put it over your face when your contraction starts. You put it on and you start to inhale deep breaths. And what happens there is, if you're inhaling like this, you're actually taking in the gas, and it helps to just numb that peak of the contraction. It does not take the pain away, however. So this is something that is often given at the later end of labor, because also this is something that you can really focus on. So this is what moms do find also works fairly okay. Just remember that the more you put it on, the more lightheaded you might also feel. It does go through to the baby, but not as severely as the pethidine, because there a lot of medication is given to you. Here, you are in control. You can decide, yes, I want it, or no, I don't want it. Okay, so remember, this is the Etinox or the laughing gas. Then the final thing for medicine is basically the epidural. Okay, so what I brought along to show you with the epidural, it's an injection medication that's given to you in the epidural space. Okay, in the lower back, you're going to have an injection. Then medicine is going to be placed in there, and usually this will remain in your back. So this is a very small, thin little pipe, and there's a specific way how the doctor will actually get it into your back. And then this is going to be plastered, on your back, that it can't move, because then the medicine is on a continuous basis going to be given to you. Okay, so it can't actually move, that it stays in place. With the difference with this one, first of all, this is the only one where the feeling of pain completely stops. Okay, so you will not feel any kind of feeling of pain. However, it is a high-tech birth. Okay, so your blood pressure can drop at any point, so you will be connected to all sorts of things. You will have the blood pressure monitor on, you will have a catheter in because you can't feel your bladder. You will have the fetal monitor on to hear the heartbeat of the baby, to see how things are going. Is baby coping okay with this? So it is still then a natural birth, but it is, you know, a little bit different in the sense that you're hooked onto a lot of different things. But for some moms, it really is a lifesaver. It's something that really works well with them. So it is something that is available. So these are the kind of medicines, you know, the kind of medicine that you can actually use. So the three things with medicine, it is the epidural, it's the Etinox or the laughing gas, and the pethidine. So those are the three things that you can have in a hospital, or most, especially private hospitals. In the government hospitals, it is more the pethidine that will be given to you. Okay, but remember, if you will have your baby in the government hospital, they also have Etinox. Etinox is another thing that might be available to you, but epidurals, normally it's not a common thing that will be used. But remember, you know, the endorphins, your body is making these hormones to help you, to support you to get through labor. Something that I haven't mentioned earlier on is the relaxation. You know, what can you do and how can you learn yourself at this, or teach yourself to really relax nicely in labor? And I would actually say you can even start today. So you basically, just by putting your hands on your tummy and just closing your eyes, and just by inhaling deep in and deep out, and then when you're breathing out, in and out, just really let go of all the tension in your body. And once you really feel that you're really dropping through the couch where you, or on the bed where you're sitting on, you basically close your eyes and you start to really either think of your baby, and by trying to picture your baby, or to try to get going with this would be, for you can even set your phone or a timer to a minute, and say for a minute you try to not to think about anything else except on the things that you can hear. Okay, so it's quite difficult. It sounds so stupid and so easy, but let me tell you, if you get to 10 seconds for the first time without thinking of anything else, you are really good. Okay, so this is something, the more you practice this, the easier it becomes. So the more you do it, it really helps you to really focus when you are in labor. Okay, so what I would say to you, how to do this from today, every day, a couple of times, set your timer to a minute, and then you try to really just relax completely, and then you start listening to the sounds. What can you hear in your environment? It might be cars driving, it might be the wind, it might be the sea, wherever you are, all the different bird sounds that you're hearing. Try to see, to just focus on those kind of things, and to not think about anything else. Okay, every time something just wants to come in that you must think of something, just shut it out. Okay, and the more you do this, the easier it becomes. This is a way how we can teach our brains to really shut off and then just completely relax, to just focus on one thing. And this is really what will be very beneficial to you when you are in labor. Okay, so I hope that actually helped you a little bit, just to give you a little bit of an outline. It's quite, one can really go in depth with every specific, you know, topic. So this is really just to understand what is available. But again, for those of you where there is no option of a lot of medicines, remember, your body can do this. Okay, you are designed to do this. You've got the hormones to do this. Okay, it's here that you have to just get your head right to think, I can do this. Okay, because you can. Right, I hope that helps. And you must, and if you have any kind of questions, feel free to ask the questions and I will answer them right now. Perhaps I can just say a first question often is, especially with the epidural, when is the ideal time to have it? Okay, that is a very common question, and some of you might wonder about that. Obviously, you can't have an epidural before you're actually having contractions. Okay, so if you go for induction, you can't start with epidural and then have the induction and so on. You have to be in active labor. You have to have strong, regular contractions. It might just stop labor if it's done too soon. Okay, and this is where if things go slower suddenly, then they have to add medication to pick them up again. And this is often where babies then start, they're not feeling, they're not coping well, where emergency cesareans might take place. You know, that is why one wants to have as little interference as possible. So you have to be in really good, strong labor. So usually by, let's say 4, 5, 6 centimeters even, that is the ideal time to have an epidural. Anything after that might be a little bit too close to the birth, because you also don't want to not feel anything after the birth. You know, you want the actual effect of it, you know, in labor and the birth itself. So that is a very common question for epidural.